so I don't get thrown off. And I'm going to try to do it without the mic, so if you can't hear me, signal. Yeah. Oh, so a lot of this has come from my experiences with people sitting out here, conversations I've had. So I really want to thank everyone for that. It's been an amazing experience, and I wouldn't have this piece without you guys. And a lot of ideas I've also gotten from our reader for seminars. So that was really helpful as well. Okay. So this is what I have to say. A couple Sundays ago, I was sitting at a pizza dinner with all our families, and suddenly my host mother jumps up and goes, "Oh shoot, I have half a watermelon to cut up still." And another host mother replies, "Life can be dreary sometimes." Yes, like HIV/AIDS. HIV, human immunodeficiency virus, a virus that slowly weakens your immune system. AIDS, the later stage of HIV, acquired immunodeficiency syndrome, where even the common cold can mean death. Worldwide, 33.4 million people are living with HIV/AIDS, with about 2 million deaths this past year. In South Africa alone, 5.7 million people are living with HIV/AIDS, with about 1,000 AIDS-related deaths every day. There is no cure, wall. But there is stabilizing treatment, ARVs, antiretroviral therapy. So on this one hand, we have this terrible virus that is wreaking havoc here more than any other country in the world, but we also have this life-saving treatment. And HIV is spread through the contact of bodily fluids, making it also completely preventable. So you would think marketing of ARVs would be unnecessary. They save lives. You would think ARVs would spread like the Lazarus effect. They work undeniably. You would think prevention would be an easy equation of the spread of information, observation, and instruction to change behavior. You would think. Wall. The government is committed to universal access of HIV/AIDS treatment and prevention. So the access is there, we're getting there. So you would think implementation would follow. Implementation does not follow. Wall. The drugs can be accessible, affordable, dangled in front of people's eyes like carrots, but implementation does not follow. Wall. Tradition. Traditional healers are a huge presence here in South Africa. They are comforting and personal. Imagine you are poor, vulnerable, marginalized. What to rely on? What your mother told you, your cultural beliefs, or the stranger standing there saying, "Take this pill." I'll take what's comforting and personal. Wall. Traditional remedies do not work alongside ARVs. They reverse the effects. And traditional healers encourage sex with virgins as a cure and induce vomiting and diarrhea as a treatment. Wall. The government is trying to work together with these traditional healers, but traditions don't dwindle with a blink of an eye, or should they be undervalued for the sake of betterment? Wall. Tradition, gender. Males dominate, leaving women behind, scraping for a reason to use condoms without being labeled promiscuous or, heaven forbid, HIV positive. Because HIV is a disease of taboos. Nevirapine for pregnant women and ARVs are the incriminating pill. Wall. The negative stigma is the glue holding the wall erect. Polygamy, prostitution, open the floodgates of infection. Wall. Rape and sexual violence combined with a poor criminal justice system allows for innocent infections. Wall. Tradition, gender, misinformation. The past decade has seen President Mbeki and his health minister undermining the scientific governance of medicine, Western medicine, an inherent distrust of the West, whites, a hangover of the apartheid years. Wall. They oppose the use of ARVs, calling them poison, toxic, and how does that sit now when people think that the health department is trying to kill them because with these ARVs that the government had labeled poison, poison, wall! They oppose the simple prevention of mother-to-child transmission and ignore the severity of HIV/AIDS. Wall. And the current President Zuma in his 2006 rape trial, claimed that shower after sex would reduce your chances of being infected. Wall. And this is all compared to Uganda, who treated the AIDS crisis like World War III. Wall. Tradition, gender, misinformation, commitment. ARVs are a difficult drug to take twice a day, at the same time, every day for life. Zoleka, my caregiver, lovely woman. Her biggest problem with HIV/AIDS patients is that they can listen, but they do not do. Wall. They do not. Imagine I was hanging out with friends one day, and 7 o'clock rolls around, time for me to take my pills. I'm not going to want to disclose my status, and I'm going to just skip my medication. Wall. Nikki, the counselor at our nearby clinic, was saying that when people are on ARVs and they feel better, look better, there's nothing visibly wrong with them, they stop their ARVs. But ARVs are a lifetime commitment, a lifetime medication. Wall. Defaulting on these drugs will only lead to another demise in drug resistance. And there are people out there who are purposely defaulting on their drugs because they want to continue to receive the monthly grants from the government for unemployment. Because if you're sick, you can't work. And if there's no work for you out there, how are you supposed to make money? And too many times it's a case where they spend all that money on alcohol, not a penny left for food, because alcohol is an escape from a dreary reality. Whoa. Twice a day, every day, at the same time, every day, for life, every day. It's hard for me to brush my teeth every day. Whoa. Tradition, gender, misinformation, commitment, culture, reality, history, wall. So this one day, I got picked up from work by a wonderful driver, Percy. Woo! And we ended up all over the place, not where we were supposed to be. And I turned around and apologized and said, "It's been a crazy day today." And he waits about 10 seconds, turns around and says, "Excuse me, but as far as I know, the sun rose today in the east and will set in the west. So I don't think it's the day that's crazy. It's the people. People are crazy!" Like some sick people have this fatalist view that people were meant to die anyway, but I just want to shake them and make them understand that if you are HIV positive, you are still a living human being. If you are dying, you are still a living human being. People are crazy, I'm crazy. I just want to shake all the children and tell them that if you are HIV, but no, you have so much potential and HIV should not be a part of it. I was walking around Kulwani one day where I worked, and there were this group of children outside, like screaming and dancing to Alicia Keys. No one should have to suffer like that. To be hopeful or not to be hopeful, that is my question. And I'm so completely torn. Because on the one side, the side of lost hope, I question who has responsibility. It's the responsibility of the patients. It is a self-inflicted disease, and their non-compliance is declining government-provided services. Or is it the responsibility of the healthcare system as a whole to create an environment more conducive to HIV/AIDS treatment and prevention? But then I think of this man that we visited, who 3 years ago was lying on his deathbed. His neighbors thought he was dead. And he began ARVs, and now he is walking and living just like any one of us. Or is it the responsibility of the whites, the blacks, the coloreds? Zoleka was telling me the story about how one day a white man drove up into our township to a store and got out of the car, and these kids smashed his windows in and stole his stuff. Zoleka turns to me angrily and goes, "If they're going to keep pulling stunts like this, the white people will never come and help." So is it the responsibility of everyone? Is this even a racial issue? Another woman, pregnant, starting ARVs this week because she does not want to pass her HIV on to her child. Zoleka is so proud. But poverty, is this even a question of poverty? To tackle the HIV/AIDS crisis, do you have to tackle poverty as a whole? Another woman, lifted up from despair, on ARVs, living, now Zoleka's former patient. But the numbers, Almost 1 in 5 adults are infected in South Africa, and with infection rates still on the rise. But the smiles, I cannot get the smiles out of my mind, the breathing, living, recovered smiles, and I don't want to be hopeless, it's just not in my nature. Life doesn't always have to be dreary. Thank you.